Good morning, everyone, and thanks so much for joining the Japan 2020 live stream covering our Olympics and everything that our team is doing to preview the games. I'm Will DuPree.
I'm Erin Cargile, coming to you from Austin, Texas, but welcome from wherever you're joining us from this morning. This is going all across our Nexstar stations across the U.S., and if you are new to this live show, we've been doing it on the first Tuesday of every month, so happy Tuesday to you, and we've got a lot to cover this morning, a lot happening on the Olympic front and just in the COVID-19 world.
Yeah, so let's start with some of the biggest coronavirus headlines here for the U.S. I mean, it's no secret that a lot of people know about President Donald Trump's COVID-19 diagnosis, and the president is now back at the White House this morning after spending 3 days at Walter Reed Medical Center in Maryland to receive treatment for that diagnosis.
Yeah, we've got video here. He left the hospital yesterday, climbed the stairs at the White House, and took off his mask in front of all the cameras. The president also recorded a video telling people about the coronavirus and said, quote, "Don't let it dominate you. Don't be afraid of it."
He suggested he's even now immune from it. His return to the White House comes after White House Press Secretary Kayleigh McEnany and 2 of her deputies became the latest Republican officials to test positive for COVID-19.
And President Trump will keep receiving treatments at the White House. His doctor told reporters yesterday that he's not fully out of the woods for another week. So we'll be obviously following any new developments on that. We want to turn to our medical expert this morning early. Sometimes we go to him a little bit later in the show, but we want to jump right into not only talking about what's happening with the President of the United States right now, but also a lot of other things going on. So Dr. Stephen Thomas with Upstate University Hospital in Syracuse, New York, thank you so much for joining us this morning.
Oh, thanks for having me.
Yeah, let's start off talking about President Trump, you know, the most powerful leader in the U.S., now fighting the coronavirus. What does this teach all of us? What is the biggest takeaway here?
Oh, I think the biggest takeaway is that anyone can be infected, even someone that has a very highly controlled life and lives in a very highly controlled environment. If you do not adhere to the public health interventions that we've been talking about for the past 6 or 7 months, primarily wearing a mask and physical distancing, not only can you be infected, but all the people in your social circle could be infected, which is, I think, what we're seeing from that Supreme Court justice nomination event.
Yeah, that's what I was going to say. I think the most eye-opening for me is not just the president becoming infected, but all of those folks around him really showing how the virus is spread, and those in close proximity to you, and the effect on those folks as well. As we just mentioned, you know, the president announced he'd be leaving the hospital Monday. He tweeted that people should not be afraid of COVID and to not let it dominate their lives. We should point out the CDC reports the coronavirus has now killed more than 210 people and sickened almost 7.4 million. You know, when someone as big of a platform as the president sends out messaging like that, you know, what kind of impact does that have on the fight against this highly contagious disease?
You know, so I mean, I think it's pretty consistent with the approach that the president and his administration has taken to COVID. First of all, so it's consistent. The second thing that I would say is that, you know, I think it's a little bit insensitive because, you know, over 210,000 Americans have died. All those people had people who cared about them. And so, and that's only the people that we know. We know that more people have died of COVID that they just didn't get the diagnosis prior to passing away. So I don't really think that that's a constructive message to be giving to the American people. And again, I think it unfortunately underscores the lack of emphasis or the lack of importance that the administration is placing on these public health interventions, which again is don't go to work or school if you're sick, wash your hands frequently, wear a mask if you can't socially distance, and socially distance when you can. And we should add one now that we're into September, October, which is get a flu shot.
Yeah, absolutely. I did that just a couple of weeks ago as well. Switching gears, moving the focus now toward the Olympics. You know, the U.S. has the most COVID cases right now. Are there concerns with having countries with high case numbers participate?
Oh, absolutely. I mean, I think a priori there's a concern with bringing. I mean, just the athletes and the people that need to support the athletes swell the numbers. Well over 10,000 people, right? I mean, this was based on the last Olympic Games, and I think it's probably even the numbers are probably even greater. So I think just bringing that number of people together is an issue. The second, bringing them together from very diverse geographic locations, of course, is an issue. And when you're looking at kind of the ebb and flow of waves and second waves of COVID around the planet, yes, your point is a very good one, that it should be cause for concern.
And Dr. Thomas, there's also this ethical question, being raised right now and circulating. If a vaccine is ready, prior to the Olympic Games, if they happen next July, should young, healthy athletes be priority with healthcare workers and the elderly, those at high risk?
That's a very good question. It's a philosophical and ethical question. It's a question that deals with allocation of healthcare resources. And in the midst of a pandemic, there are multiple groups that have come online and sort of given their list of priorities. And young, healthy athletes would not be with even the first three phases of those of most of those schemas. So it'd be typically people that are at high risk of infection, or people that are at high risk of a bad clinical outcome if they are infected. So this would be healthcare workers, this would be first responders, this would be elderly people with comorbid conditions, other medical problems. This would be people that live in group housing like skilled nursing facilities, et cetera. So young, healthy athletes probably don't fall into those categories. And so each country would have to, sort of figure out, again, philosophically and ethically, what they're going to endorse.
Dr. Thomas, during the past few months, we had talked about your hospital's participation in some of the vaccine trials. From what we know is that you all are helping one of two vaccines that are in phase 3. What is the status there in Syracuse from what you all are doing?
Yeah, so we're fortunate that we are one of the participating sites in the Pfizer BioNTech. That's the collaboration in their phase 3 vaccine trial. We've, as you probably have seen in the paper, they're enrolling up to 44,000 people. So the initial wave was 30,000 people, and then they're going to expand that to go up to 44,000. They're going to expand the age range of people that they are enrolling, and they're going to go below 18 years of age. So we've enrolled a couple hundred people. It's gone quite well. Folks are very eager to kind of roll up their arms and roll up their sleeves and get either a placebo or the vaccine candidate. Everyone's blinded. No one knows who's getting what. And when you ask them why they're doing this, the answer is pretty universal. They want to make a difference. They're tired of this pandemic, and they believe that a vaccine could be a very valuable tool to start to try and end it. So it's going well.
That's great news. We all know we'll be excited definitely when a vaccine is ready. The timing of that is different depending on who you talk to. But for regular folks like us and athletes, how should people balance the risk versus reward of a vaccine, and when it's ready, should they move forward and do it?
So there have been a lot of more discussions have been going on in the press than I've ever seen regarding development of a vaccine or the review and potential licensure of a vaccine. So what I would say is that there are multiple systems and processes in place to make sure, first of all, that a vaccine can even be tested in humans. That's the first thing. The second is to ensure the safety and the quality of the safety of the volunteers and the quality of the data that's being collected while the trial is actually ongoing. And then once all the data is complete and the company or the sponsor decides to engage a regulatory agency like the US FDA, then there are multiple other layers of review. And the review is done by objective and disinterested parties. So people that don't work for the company, people that are not involved in the vaccine trial process. And so, I personally need to have confidence in scientific method. I have to have confidence in the redundant external review process that occurs, and I have to have confidence in the civil servants that work within our FDA, whose job is to protect the safety and welfare of Americans by ensuring that only the safest and effective products make it on the shelf. And so, if the FDA does review one or more of these vaccines and puts its stamp of approval, then I, for one, am going to believe that it went through the same review that all the other vaccines and drugs that end up on the shelf went through.
One final question for you, Dr. Thomas, before we let you go. What are your thoughts on the CDC now backtracking on its guidance about how the disease is spread? So the agency now says there's a chance that people could get the coronavirus more than 6 feet apart if they're infected through the air, particularly in enclosed areas with poor ventilation. What do you make about this action taken by the CDC now?
Yeah, they've had, unfortunately, a couple of missteps through this. So, I think just at baseline, whenever you're talking about a virus that is in the respiratory tract, there is always the potential that it could be airborne under certain conditions. We've recognized that from the beginning. What you need to do, though, is you need to understand what is the most common way that the virus is transmitted, because that's where you need to really focus your efforts and focus your resources to try and protect people. So although airborne transmission is possible, although in the laboratory they've shown that it's possible, although there have been some reports of instances with people on planes or on buses or in restaurants where they did not come in contact but they were infected, we know it's possible, but the most common mode is through droplets. And so what that means is the bigger and heavier droplets, the respiratory droplets that get put in the air when somebody sneezes or coughs or is breathing very heavy or shouting or singing or things of that nature. We still believe that that's the primary mode of transmission, and that typically occurs in a much smaller circle than what airborne transmission can occur. And so we're talking 6 feet or less, people 5, 10 or more minutes within that 6 feet a radius of a person who's infected. That's the most common way that people get infected.
All right, Dr. Stephen Thomas out of Syracuse, New York, we are so appreciative every single month of your time and your expertise as we continue talking about the health concerns surrounding the Summer Olympics next year. Thank you, and good luck with everything you guys have going on there to help keep us all safe and healthy.
Thanks. Have a good day.
You too.
Always such a nice time. Of next year, which, if you think about it, is not too far away. The committee released this map showing the route the relay runners will take as they travel across Japan for 121 days. Organizers say they are specifically going to areas devastated by an earthquake in 2011 so that they can showcase the recovery. Yeah, they're also hoping the relay will symbolize the light at the end of the dark tunnel and a beacon of hope during the ongoing global pandemic. I've heard that a lot from a lot of different organizations and entities, really hoping that this is the moment that our entire country can, come back together and have something to celebrate and look forward to. Now, the torch is currently on display through November 1st at the Japanese Olympic Museum in Tokyo. Tokyo, organizers say COVID-19 could still impact the torch relay next year, but they will release more details about that at a later date.
Yeah, and Olympic organizers, they keep saying they would like to have fans attending the Summer Games in Tokyo. Every single month we get on here and we say, will there be fans? Will there not be fans, like we're seeing, in so many sports right now here in the U.S., particularly, the NFL, even here at, our college games at the University of Texas with the cardboard cutouts, in the stands. But some upcoming sporting events are not allowing spectators, because of COVID-19. So we would have to wait and see.
Yeah, including one of them later this month. People cannot sit in the stands and watch the skaters at Skate America, which is the top annual international figure skating competition here in the U.S.
Yeah, two-time men's world champion Nathan Chen will headline the event, which is scheduled for October 23rd through the 25th in Las Vegas. I was just telling Will before the show started, I actually got to see Nathan Chen skate in Pyeongchang at the last Winter Olympics, and that was quite a highlight. Of course, he didn't do as well as we had hoped he would do, but what a moment there. The competition will also include only American competitors and those training in the U.S.
That's pretty interesting. They're only doing that, but I guess they're trying to reduce the spread and other athletes potentially coming here and getting it.
Yeah, but continue keeping the sport going, continuing doing what they do.
Yeah, so important. Another big sport, obviously, that people like to follow in the Olympics is swimming. So here in the U.S., USA Swimming is remaking some of its national events for at least the rest of the year.
Yeah, that is going to include launching a virtual competition to recognize top performances before returning to in-person competition in November.
Yes.
Meets scheduled in Southern California, Virginia, and Georgia over the last 3 months of the year have been canceled.
In their place will be a national leaderboard series beginning this month. It will consist of sanctioned and non-sanctioned long course and short course meters and short course yards results.
The U.S. Open will happen from November 12th to November 14th at up to 10 venues nationwide. The long course meet will feature about 100 swimmers at each site competing in 4 timed final sessions over the next 3 days. And then just in talking about Texas, we've got a lot of swimmers training for the Olympics, a lot of Olympic hopefuls here at the University of Texas at Austin. I follow all of them on Instagram, and they're posting pictures like crazy of their practices and different competitions that they're taking part in and doing so safely. So it's at least exciting to see them back in pools, because a few months ago we were talking about them, having to train in isolation or at a home swimming pool or whatever. So it is just nice, a breath of fresh air to see them back in their training environment.
That is true. Well, if the Summer Games is indeed held next year, some notable NBA players may not be able to compete for the U.S. in basketball. Yeah,
we talked about the timing and the pushing back of the Olympics and how many other things it's going to, push into, and this is going to be one of them. So the NBA commissioner told CNN recently the next season would not likely start until at least January due to the pandemic. Adam Silver added that the later schedule could mean some of the top U.S. men's players may miss participating in the Olympics in July.
Now, the Associated Press did note that a January start for the NBA season could mean a June or July regular season finish, with playoffs concluding in August or September. That could obviously greatly affect the Olympic trials, because those would most likely start in June or so. So a lot of those teams that don't really want to sacrifice their best players to be able to go and to participate in the Olympics may not be able to participate this time.
Yeah, I know that's probably disappointing for a lot of them. I've been watching that Michael Jordan documentary, and it highlights some of his time when he played for Team USA, and so it is sad to think that some of these top players we're not going to be able to see compete on that global world level.
Yeah, we'll have to see about that. And our final headline today, the Tokyo Olympics are facing renewed scrutiny over allegations that the city's bid to host the games actually was secured by millions of dollars in bribes laundered through the international banking system.
So according to the top French prosecutor who talked to NBC News, a team of more than a dozen French prosecutors and police investigators is investigating allegations of corruption associated with the Tokyo Olympics bid. This inquiry came after a 5-year investigation into Russian bribes that let athletes compete despite positive doping doping tests, which resulted in multiple convictions by a French court last month.
Both the case that was just decided and the Tokyo Olympics investigation center on payments made to a Senegalese father and son duo. Of course, we'll have to keep tracking that to see what, if anything, any charges potentially or indictments come from this investigation in France.
Yeah, we'll keep updating you on that throughout our coverage here, and next month we'll see what's going on there. Well, let's talk about some good news. How about that?
It's nice to end that way, yeah.
It is, for sure. So the Tokyo Olympics will feature a brand new sport for athletes to compete. Surfing. We obviously here in Texas, we're not the experts on this sport,
No.
so we've got to go to the man who is one of the Next Star Nation reporters who has covered multiple Olympics now, and you could probably guess what state he lives in.
Right. In California, they're talking about surfing and what they're doing to prepare even during the pandemic. Andrew Martin from our sister station in Fresno, California, has this story, so take a watch.
Chances are, when you think of surfing, the first name that comes to mind is Kelly Slater. He's considered the greatest professional surfer of all time, with 11 world championships. In 2015, Slater opened a surf ranch in Lemoore, California. He was there last month.
For us, I mean, we're in the ocean, we're pretty socially distanced. I was in Australia for 3 months, and the whole time I was there, you were able to surf the whole time, and COVID was super under control. So I don't think surfing is the problem, and I think it makes sense that we get back out there.
Kelly Slater's surf ranch is 2,000 feet long and 500 feet wide. It costs $30 million. At any given time, though, it's home to some of the best surfers in the world, including, for the first time, Olympians.
You know, it's so rad to have surfing in the Olympics. It's like the highest, it's one of the only things in the world that brings the whole world together, and it's really special, and surfing's, reached that level of professionalism.
Just 18 years old, Caroline Marks qualified for the Tokyo Olympics this past December. She finished 2019 as the second-ranked American woman in the world.
It was a big battle at the end of the year, but super stoked to make it because all the girls were surfing so well. And like I said, first year ever, it's in the Olympics, so it's monumental.
Kelly Slater, however, will not compete at the Olympics, and not because of his age. Slater is 48. But he lost in the semifinals at the last qualifying event in December. On the journey to Tokyo, I'm Andrew Martin.
Andrew Martin joins us now from Fresno via Skype. Andrew, thank you so much for being here.
My pleasure, Will. Great to talk with you.
First off, I want to just point out something. In your story, you went to a surf ranch. I have never, ever heard of a term like that or seen a place that offers that kind of service. What kinds of things happen there?
Well, it's man-made, Will, so pretty much anything that you want. It was designed specifically for elite-level athletes, specifically surfers, and Kelly Slater is an 11-time world champion. He has a lot of money and a lot of influence. He decided that he wanted his own place where he could bring his friends and now Olympians and future Olympians, Olympic hopefuls, to a place where they can actually compete. So he built this surf ranch in Lemoore, California. It's not the only one in the country. I read that there is one in Waco, Texas. I've never actually personally been there myself, but it's a place where athletes can actually simulate what they experience out in the water, out on the ocean. And this particular surf ranch is 2,000 feet long and 500 feet wide. It is massive.
Now we're going to see surfers compete for the very first time at the Summer Olympic Games next year. How competitive do you think the U.S. will be at that competition?
Yeah, well, Will, the U.S. should be really, really good. The U.S. team has already been named. All 4 competitors were named in December of 2019. And it's kind of interesting how this whole thing is going to play out. Surfing is one of 5 new sports for the Olympics. There will be a total of 40 competitors, 20 men and 20 women. Each country can have a maximum of 2 per gender. And the U.S. team is impressive. The girl Caroline Marks, in my story, 18 years old, she finished last year, again, just 18 years old, as the #2 ranked woman in the country. And Carissa Moore, who is the #1 ranked woman in the world, is also an American. She is a 4-time world champion from Honolulu. So I think the expectations are pretty high for the U.S. in surfing.
Andrew, we keep talking about the possibility of the Olympic Games potentially not happening next year because of the ongoing issues with the coronavirus pandemic. What are you hearing at this point? The Games are still set to go on.
Yeah, well, Will, it really depends on what you believe, but also how many different outlets that you read. Because my personal feeling is it will be tough to have the Olympics without a vaccine, because you're talking, 12,000 athletes, several hundred countries. You really don't want athletes to then bring this back to their countries, because then you have a plague on your hands. But if things are under control, we know that the IOC desperately would love to get the games underway. Obviously, it is a multi-billion-dollar enterprise, and they've had to spend billions just to move it back a year. So everything that we've read is the games are going on as scheduled for next year, but obviously things can change, on a whim, depending on what happens worldwide.
Andrew Martin, thanks so much for joining us. We really do appreciate it.
My pleasure, Will.
It is good to see Andrew Martin. Again, he is one of the members of our Next Star Nation team who is planning on going to Tokyo in July of next year. This will be his third Olympic Games.
Wow.
So he covered the Olympics in Rio, De Janeiro, Pyeongchang with me, and then, like all of us, looking forward to going to Tokyo as well. That is crazy. The athlete in his story that he was talking about, just 18 years old.
I mean, really think about that. Like a high school senior will be competing at the Olympic Games. I mean, it's just amazing, like the athletic ability and the confidence it takes to be able to compete on that level.
Well, yeah, and the mental aspect of it all as
Yeah.
well. And imagine, I mean, no matter what sport you're in, obviously you are just sad and have had to adjust to the changes and the postponement and all of that. But imagine if it's the first time your sport has ever debuted at the Olympics,
right,
and then it doesn't happen, and there's a postponement, and now is it even going to happen? And so they have a totally different level of just having to kind of go with the flow here, which they do in surfing as well. A little,
pun intended. Yeah.
Yes.
Well, I mean, that's everything we wanted to talk about today. We touched on so much, talking about the coronavirus pandemic and getting that update from Dr. Thomas there in upstate New York, and then touching on all these different Olympic headlines. So we do appreciate you joining us today.
Yeah, we hope the rest of your Tuesday goes well. We're going to be back on the second Tuesday of next month in November because of the general election. So we don't want to conflict with that. That's going to be a big day, much bigger, obviously, than the Olympics at this point.
Yeah, we're going to be very busy that day, and every newsroom across the country will be as well. So we want you to join us again on that second Tuesday of November, and we'll see you back then. So I'm Will DuPree.
I'm Erin Cargile from Austin, Texas, and have a great rest of your week.